podcast is brought to you by Delta Neurohealth, located in Columbus, Ohio, where non-invasive, personalized care is revolutionizing the way we approach complex neurological issues. With cutting-edge techniques in functional neurology, functional medicine, and chiropractic care, we're leading the way in managing conditions like concussion, dizziness, brain fog, anxiety, POTS, attention, and more. To learn more, visit our website at deltaneurohealth.com. Hey everyone, welcome back to the show. I'm your host, Dr. Joe, and today we are joined by Dr. Heather Heck of Holistic Health. Thank you for joining us today.
Yes, thank you so much for having me on.
Yeah. And like I was telling you before we started the podcast, I've heard so many great things about you and your practice and the people that you've been able to help since starting here in Findlay, Ohio, correct? So I've been really excited to talk to you directly and get to pick your brain a little bit.
Yes. Thank you so much.
So, before we dive into the topic, which is really interesting, psychedelics and neurological healing, which I think is awesome. Um, can you tell us a little bit about you and your practice and maybe your journey to get to this point?
Yeah, so I've been in practice, gosh, it's almost been 20 years. I'm, of course, a chiropractor by trade. I have a specialty in pregnancy and pediatrics. I also practice acupuncture and Chinese medicine. Um, and along with that, I have my master's in nutrition. So I feel like the more tools I have in my toolkit, the more I can help my patients. And that's really served me well through the years. Um, Prior to last year, I had been in a medical practice. So we had pain management, ortho, podiatry, urgent care. We had a surgical center. So it was just a beautiful synergy of everybody working together. And I loved that. But I also just kind of got burnt out by insurance and the sickness model. So last year I went on my own private practice. I started my health podcast, and just kind of opened my mind to other modes of healing, outside of what we're traditionally taught.
Hmm.
So, it was funny because my husband, he's big into researching too, and he sent me some information on psychedelics probably a year and a half or maybe 2 years ago. And I kind of poo-pooed it at the time because psychedelics are still kind of taboo.
Hmm.
And I had some downtime when I left my practice and I was starting up, and I looked into it and I listened to a couple, and I was just blown away by the research because for me, being in the medical model, I'm a very evidence-based girl. Show me the research. It might, work through, the centuries and through old wives' tales, but let's find the biochemistry behind it and let's figure out why it works. And sure enough, there's fantastic research coming out. So I kind of went down the rabbit hole and reached out to a couple of individuals, and I interviewed them on my podcast. And I just kind of felt a calling to experience it myself and dive into the research. And it's been such an incredible journey. I'm so blessed.
That's awesome. Yeah. Well, I'm excited to pick your brain on what you've learned so far and what you've experienced. Um, so psychedelics. Kind of a taboo word, I think, generally speaking. Can we first just put a definition to psychedelics?
Yeah, so really, when we think of psychedelics, we think of brain-altering substances, right? So psilocybin, LSD, there's ayahuasca, there's numerous ones out there, and they've been used for centuries to, get out of the conscious mind, get in that subconscious, tap into the mystical, spiritual world. Of course, in the 60s and 70s, that's kind of where they became more of a taboo subject.
Hmm.
They were really being studied in the 30s and the 40s, and there was fantastic research. So that's kind of like where we are at now. And right now, the only place legally that you can go for a couple of these treatments is in Mexico. So, yeah, I know in Texas, they're working on some legislation to make it more of a medical treatment for some conditions, especially for the mental health world.
Mhm.
But yeah, right now it's still pretty taboo. It's, obviously not legal in the States. So,
Mhm. And so when looking at, I mean, traditionally we think of psychedelics as, a like you said, recreational in nature, and then maybe some experimental uses back in the 60s and 70s as well. So how do psychedelics actually work? What role do they play, and what kind of impact do they have on the brain?
oh my gosh, there's so many. So a lot of them actually affect the neuroplasticity in the brain and they target serotonin receptors. So, depending on what psychedelic we're talking about, whether that's psilocybin or 5-MeO-DMT or iboga slash ibogaine, they all kind of have their different features depending on what pathology you're seeking healing for. So, for example, like with ibogaine, right now that's being studied a lot with veterans for TBIs, for Parkinson's, for neurological healing, because it actually affects the glial healing in the brain. And then, yeah, we can talk about the research here in a bit. So it's actually from a biochemical perspective, creating healing in the nervous system, but also affecting the neurochemistry too.
Hmm. Okay. Um, so you said PTSD, TBI. What other conditions have they been researching uh, with psychedelics?
Yeah, big ones, MS, Parkinson's, anxiety, depression, amazing results with a lot of patients getting off their antidepressants,
Mhm.
which we know they have a 60% success rate. And in practice, I see many patients on more than one antidepressant, and they're still not living their best life.
Mhm.
So, with a lot of these psychedelics, actually, I should say with most of the psychedelics, what they recommend is something called integration. So, when you go through that psychedelic treatment or experience, you're trained and you're coached on the behavioral changes as well. So, really, kind of rewiring your response in your brain with, self-care that we talk about. So meditation, breath work, getting out in nature, um, things like that. So yeah, as far as like the pathologies that the hard research is coming out, a lot of it's the mental health, but the neuro conditions as well.
Really neat. And so obviously it's not legal here yet, right? So where are we at as far as, research to actual application and seeing these things become more readily available for prospective patients?
Yeah, so right now, as I said, Mexico is the main place that you go. It was legal in Canada up until I believe 2012, 2011. I don't know the exact date. And then it was made illegal again.
Mhm.
But there's a lot of legislation going on right now in Texas. We're seeing Stanford study a lot of these psychedelics and a lot of other universities. Again, from like the veterans perspective, there was a study that came out not that long ago. We call it the Stanford study, where they looked at ibogaine slash iboga for veterans with TBIs and PTSD. And the results were just amazing. That was actually published in Nature Medicine last year. So, yeah, there's some really neat things coming out.
Very cool. Now, one thing I always, consider is anything that has the potential for good and positive probably also has the potential for negative. So I'm curious, what are some of the precautions that, we need to take around psychedelics? Why might some of these countries be, hesitant to give them the green light?
That's a great question. From my from my personal jaded perspective with medicine, I don't think they're getting the green light because they work, right? If we can heal MS to some extent, if we can heal Parkinson's, we don't make money in that. We don't make money in wellness. So, in because it was funny, I just in January I went down. to experience it myself in Mexico. And in Mexico, they don't legalize, you can't take cannabis in and you cannot take vapes, but
Okay.
they'll allow psychedelics.
Okay.
So, it's interesting. My personal concern with them potentially legalizing psychedelics to some extent is anytime you take something, I don't want to say mystical, but cultural and something that's been around with these cultures for centuries, and
Mhm.
you make it a medical treatment, you lose that mind, body, spiritual healing to it.
Mhm.
So there's a couple of examples. You could experience the psychedelic journey by preparing for it with a lot of different ancient modalities, or you can receive it in a hospital bed. And it just, to me, that's not the same treatment. Um, the biggest concern right now with it getting the green light in the States, especially with like iboga slash ibogaine, is it can have some cardiac side effects. So the biggest one with that is it could increase that QT interval. Um, I, of course, researched it before I experienced it myself because there is the risk of death. And a lot of the death cases were patients who were not completely off of opioids. So
Mm.
you actually have to be off of opioids for a period of time, antidepressants, medications, alcohol, caffeine. Like there's a protocol that you do. When I went down, you have to have an EKG before you go down. When you get down there, you get an EKG, you get blood work, you get hooked up to monitors. Like it's very monitored to prevent anything from happening. So, as with anything, yes, there's side effects, but there's a lot of ways to mitigate those side effects.
Mhm.
And they also, with the ibogaine treatment for the vets, they actually give you magnesium to prevent that QT disruption.
Okay. So I'm glad you brought up opiates or opioids. Um, Obviously that's a huge problem in our country. What has the research shown as far as the efficacy of using psychedelics in addiction management?
Huge, huge with alcohol and addiction. Um, and even, heroin, cocaine. The amazing thing with it is a lot of times it changes not only that neuroplasticity, but that addiction craving in the brain. So we never say there's like one and done with the treatment, but a lot of times when a patient or a client goes down there and experiences it, they never touch that drug again,
Mm.
which is just wild. A lot of these vets that are receiving treatment are reporting resolution of opioid use, alcohol use. For me, as simple as it was, I, like most Americans, was addicted to coffee. And since I've been back, I have no desire for coffee.
Interesting.
So it's just wild. It just rewires your brain.
Mhm.
Um, and again, it just basically changes the neural structure and the plasticity in it.
Okay. So another devil's advocate question. So with obviously we're talking about addiction now. Is it possible or likely or plausible that somebody might then find their way into addiction with a psychedelic? And then follow-up question, considering neuroplasticity, you had a positive neuroplastic change. Is there the potential for maybe negative neuroplastic change or a negative experience with it?
Two great questions. So, with the potential of getting addicted to psychedelics, absolutely not. At least from my experience with the 5-MeO-DMT and the ibogaine, it's one of those where there's like a lot with the ibogaine and ayahuasca, there's a lot of purging that goes on. Whether that's through vomiting, diarrhea. For me, I was grateful because my purge was crying. And the journey lasts, depending on what psychedelic you do. Like for Ibogaine, it can last up to 36 hours. It's not fun. It's a wild ride, and it's not something that you want to just sign right up for again. The 5-MeO-DMT, same thing. It's a very short trip. It lasts maybe 5 to 10 minutes at the most. And it's called the ego dissolution. It's the death of the ego, and it's not fun. None of these are fun, but coming out on the other side and having those results, either from a injury standpoint or addiction standpoint, is just worth its weight in gold. Um, there are, from what I've seen from cases and patient experiences, there are some bad trips, absolutely. Um, there's no, at least from what I've seen in the research, there's no negatives. Like it doesn't make you worse. There's no way it can make you worse. Um, but it might, when you're on that psychological journey, it might show you things that you don't want to see. Like, for example, if a veteran's been through war or seen individuals die or has killed people,
Mhm.
that might come up. Uncomfortable situations might come up. And that's why it's so important to do that integration before and after and during, just to support those emotions that come up. For me, I experienced and this is very common with that 5-MeO DMT, because it kills the ego. A lot of people think they die and
Mm.
they experience death. And when I went into it, that was one of my fears. And sure enough, I saw myself physically die, not literally, but physically. But now coming out on the other side, I can say that I'm not scared to die. And it showed me so much more of a appreciation for, my children, more patience, more gratitude. Um, it's really amazing. So they always say with psychedelics, it can never make you, I shouldn't say never. It typically doesn't make anything worse. It takes the bad parts out of you and amplifies the good. So if you do have an addiction to XYZ, it removes that craving for addiction. Um, a lot of people when they go on these trips, they come back and they're in different hobbies, or they might get a divorce, or things like that. But it shows you things that probably need to happen that you are scared to make those changes.
Gotcha. Okay, that makes sense.
Yeah.
And you've kind of alluded to your experience so far, but I was wondering if you could just kind of walk us through your story. You flew down to Mexico. How did you find, the clinic that or the space that you wanted to go and experience it? What did you decide to, if you're comfortable talking about that?
Yeah, absolutely. So I had interviewed one of the founders at Ambio, and I learned of that clinic through the Sean Ryan podcast and Joe Rogan. So I had contacted Trevor Miller. He was on my podcast. I interviewed him, and after that interview, I'm like, I have to do it. I have to go down. I just have a calling, and they say that with a lot of people, you'll get a call to go down there. So I interviewed him, I think in July, and I signed up for June because I had my last baby in August.
Mhm.
And you fly into San Diego. They pick you up, and their clinic is in Tijuana. So it's a short, 30, 45-minute drive. You do need an EKG before you go down. As soon as you get down there, you get hooked up to an EKG. They go through your medical history, you meet with physicians, they talk about any prescriptions that you're on, any supplements, and you're with it's a small group. You're with, at least for me, it was a group of five, so there were four other women, and I didn't know anyone going down there. And that first day you get in, you do a Temazcal. So it's a sweat lodge. It's a traditional sweat lodge. So it looks like this little clay pot that you hop into for an hour. And it's traditional. There's a woman who led chanting and drumming and a guided meditation. And it's really, you're in the dark. It's extremely hot. I think my eyebrows got singed.
Mm.
Um, it's a test of endurance. And I see they are preparing you for the medicine because can you handle the discomfort, right? And after each, they do a couple rounds of 20 minutes. And after each session, you get hydrated and things like that. So that's like the first bonding experience. You do some massage, you do a lot of coaching, a lot of group sessions, which is wonderful. You have a couple sessions of breath work, again, just to kind of prepare you for the medicine. And coming from a place where I've taught yoga for years and I'm pretty comfortable with breath work, I didn't think I could learn something, but I learned a lot. And again, it's we all have an ego. It's kind of leaving that ego at the door. Um, and it's the second or third night you take your psychedelic ibogaine, and it's dosed per kilograms of body weight. It's encapsulated, and you do 4 capsules. You do a beautiful fire ceremony. And before you go down, you have a coach that you meet with a couple times. So the premise there with the fire ceremony is you want to burn anything that you want to get rid of in your life. So for me, it was just working through relationships, anxiety, stress, common complaints. And then there's a gratitude list that you can take into the journey with you. They have like a little mirror and a little altar. And it's the medicine, ibogaine is, or iboga is from Africa, West Central Africa. So when you take the medicine and the medicine starts to kick in, and again, you're hooked up to an EKG and everything, and there's a nurse per each person. They're playing the African music, and as soon as you feel it kick in, you can pull your eye mask down, and then you lay on your mattress. For me, my journey lasted, I want to say about 8 hours, 6 to 8 hours. It's hard because they give it to you at night. And all the blinds are down, so you have no idea of time. And they take your electronics before, and you don't get it back until the last day you leave. So it's just a nice way to disconnect and self-reflect.
Mhm.
Um, Before you go into the medicine, they give you an IV. And again, they used a lot of magnesium to prevent that QT issue. When you come out of the medicine around 8 in the morning, they give you another IV. Um, and then after that, they call it the gray day. And you're in this house and you have your own room, and they take you back to your room. And that gray day is kind of like um, your worst hangover times 100, I would say. You just
Mhm.
kind of feel out of it. They say that's the spirit coming back into the body. And I think, I mean, we all felt that. Only 3 of us made it downstairs for dinner that night. Um, we just watched a lot of movies to kind of get out of our own heads. And then the next day we felt fantastic. You just feel on top of the world. And then you do 5-MeO DMT. 5-MeO DMT is also known as Bufo. It's from the Colorado River toad. There's a lot of plant sources as well. That is, they say ibogaine is sandblasting you from the inside out, and 5-MeO DMT kind of polishes you up. And it really does. It's a very short trip. You smoke it, and you're offered a couple hits off of that, and it's the same molecule you make when you die
Mhm.
and then when you're born. So that's why a lot of people die, right? That ego dies. But the research shows, it works as it's very serotogenic, so it's great for anxiety and mood disorders even after one use. Um, and again, it works with that neuroplasticity. So for me, I just did one hit because I didn't I didn't want to die again. That was enough. And then yeah, you just have tacos the night before you leave, and they drop you back off in San Diego, and then you fly back.
How long of a time frame are you down there?
Yeah, so I went down on a Tuesday. They recommend that you come in the day before, so there's no issues, and then they recommend that you stay a day later. So they pick you up Wednesday morning, and then they drop you back off on Sunday. So it's really a lot packed into a few days.
Hmm.
And I'm still so close with a lot of the women that I went through the journey with.
Hmm.
And it's just so nice to have experienced that. I've noticed such huge improvements just for myself. And again, I kind of went down because I was curious, how else can I help my patients? And I just, is it too good to be true? It's not. It's really that amazing. I'm working on planning a women's retreat later this fall or early next year, because I have a lot of my patients that are interested. They're just sick of being in the brain fog. They're sick of being anxious and being on medications. So
Mhm.
yeah, it's quite exciting.
Okay. Okay. Um, so is this, so you mentioned that the coffee addiction that, you would classify yourself as having kind of went away afterwards. What are some other positive benefits that you think you noticed afterwards?
For me, I mean, I kind of went down what I felt like as a clean slate. I didn't really have a lot to get rid of. Um, it helped to heal two of the relationships that I went down
Hmm.
wanting to work through. It got rid of coffee, which I didn't really want to get rid of it, but it's been a great change. I don't feel um, that need for it or that constant again addiction. Like I have to have it.
Hmm.
I'm more at peace and I'm more calm. So right now, my youngest that I had in August, he just turned 7 months. And
I
before
have a
I went,
7-month-old as well.
oh, do
Yep.
you? Congratulations.
Thank you.
Yeah. So, and you know this well, like they wake up and then a lot of times you don't go back to sleep. You're scrolling.
Hmm.
It's just you're exhausted.
Yeah.
So I went down there not anticipating any changes in my sleep. And when
Hmm.
I got back, I would get up, give him a bottle, close my eyes, and I was in deep dream state sleep.
Hmm.
And I've had that continue every day since I've been back. And I can't remember the last time I dreamed. It's probably since I was a little girl. Um, so yeah, just deep, deep sleep. As a mom, I don't feel anxious. I don't feel that rushing around like everything has to be clean, everything has to be perfect. I'm not thinking of my to-do list.
Hmm.
When they dropped me to get back off at the hotel, I had, I don't know, I was there that night and then I flew out early the next morning and I just sat there on my patio and watched the boats on the water for probably 2 or 3 hours.
Hmm.
And I can't tell you the last time I wasn't going to pick up my phone or thinking of things I have to do or
Hmm.
worrying about something. Like I was just appreciating the water, the sun, the air. It was wild. Yeah. And it's still, even now I wake up and I hear the birds singing and I'm just so grateful, um, grateful to be alive and to be having this human experience.
Yeah. I mean, that sounds like a beautiful existence to be in. Yeah.
Yeah. Yeah. And it's neat now that I'm on this other side, you asked if you could get addicted to psychedelics. Now that I'm on the other side though, I want to keep improving myself, right? Because I know that we don't have to live this standard American life of keeping up with the Jones and making
Hmm.
all this money and being perfect and, XYZ. That's not, at least in my opinion, what we're meant to live this life for.
Hmm. No, that makes sense. So right now, if a patient wanted to experience what you experienced, they would have to go to Mexico or
Mhm.
another country that allows it. Obviously, the US is working on, its version of how this might be, acceptable in the States. If you, having experienced it and done the research, if you were in charge of the legislation and could kind of uh, design what psychedelic medicine would be like in this country, what would that look like?
Again, to me, coming from that holistic approach, I would want to model it after what I experienced
Hmm.
with having all of that preparation work.
Hmm.
Um, and all those experiences, the massage, the Reiki, the sweat lodge, having a personal coach.
Hmm.
Um, And then just integrating making breath work and meditation and getting out in nature mandatory. Not mandatory, but part of the program. Just like the place that I went to, I think they've got a great thing. Now there are a couple of organizations out there. So if, a patient is a veteran or a first responder, there are opportunities for grants to send them down there for healing, which I absolutely love. In the meantime, between, now and when it's legal. But yeah, for me, I would want it to maintain that holistic, mystical approach. I wouldn't want it to lose that with being medicinalized.
Yeah, yeah, hospitalized, yeah.
Right.
Okay. Okay. Well, I think that would be amazing if, that became a reality. What's a potential time frame on that even existing here?
Gosh, I honestly have no idea. I'm not very up on the political aspects of this because I'm just getting
Hmm.
into it. I do know that, of course, Governor Perry and Brian Hubbard out of Texas are working hard on getting Texas legislation to get pushed through for mental health. I don't know of what else is going on in the States. I know, they're trying to get it reclassified as a supplement more versus a drug. So we'll see. With the new administration, who knows? Who knows? We're in a lot of uncertainty, so there's the potential. I feel like heck, 5 years ago we weren't talking about psychedelics like we are now, and vaccines and milk, raw milk, and all of the holistic stuff.
Hmm.
Um, so yeah, it's just tough to say what the time frame is. But I do know that uh, it's gaining in popularity and the research is just amazing. If do a research search for just this last year, there's amazing things coming out on it.
Hmm. As far as this becoming more mainstream, some of the substances, come from specific parts of Africa, come from that toad in Colorado. Ecologically, is it sustainable, like mass producible for the number of people that could potentially benefit from it?
That's a great question. I know they're using a lot of synthetic versions.
Hmm.
Of course, like obviously we don't want to torture a poor little toad. So the synthetic version is what I did down in Mexico.
Hmm.
And I have seen some things recently with, say, like peyote,
Hmm.
because that's gaining in popularity. A lot of the cultures are voicing concern about the sustainability of it, right? So again, I think if it's because to me, plants have spirits and plants are medicine, they have to be respected. So I think if they're done correctly and we can find some biological synthetics that are just as good, that's the way to go. Um, so yeah, I don't know. We'll see. That's a great question.
Yeah, just curious, yeah,
Yeah.
what the future might look like for that.
Yeah. Yeah, it'd be great. I mean, heck, I would love everyone to experience it. I think the world would be a better place.
Yeah, sounds like it.
Yeah.
Um, okay. Is there, well, anything else that, we might have missed that goes into this topic that I haven't asked about yet?
You know, not a whole lot. I would just, the only thing I want to mention is that, like last month,
Hmm.
there's a research article that came about ibogaine and MS,
Hmm.
and it showed about 70% resolution of the lesions.
Wow,
Huge.
that's great. That's insane.
Um,
Yeah.
Yeah, just amazing. Of course, like it affects like the glial neurotrophic factors, and that can affect, of course, neuroinflammation. But yeah, they show pictures. There were two case studies, um, and the one patient noticed about 24% increase in physical components of their complaints, 42% improvement in mental components.
Mm.
And despite having previous gait challenges, later reported completing a 200-mile ultramarathon.
Wow.
Yeah.
Wow.
Yeah, just like it's amazing. Is it that good? Yes, it's that good. I know there in my group, it was funny. There was a 70-year-old woman who was a doctor in counseling. She was there because her son had gone through it.
Hmm.
There is also a woman who has had use of opioids, two failed back surgeries, and MS. And so you wait 3 months to re-image. So we're just now almost coming up on our 3-month mark, and then she's going to share her scans with everyone, and we just can't wait. But I just spoke with her, and she's no longer in back pain, um, and she's so much improved. It's amazing to me.
So cool. Yeah.
Yeah.
Well, you've definitely piqued my interest even more. So yeah,
Yeah, I'll have to share my research with you.
yeah, please do. I'd be very interested in it. Obviously, our patient base is very neuro-oriented, so
Yeah.
things are going to be right up their alley. So this is great.
There was even, I'll mention real quick too, there was even a study done on, it was a case study again, which, isn't high up on the research world,
Hmm.
but it was looking at brachial plexus injury, like a nerve plexus root avulsion,
Hmm.
which, of course, you try to do reattachment, you do therapy. A lot of times there's amputation involved.
Hmm.
And this individual noticed a huge improvement with pain and functionality with it.
Wow.
So even something I don't want to say simple, but
Hmm.
not necessarily Parkinson's or MS, but like nerve root issues, it has the potential for.
That's amazing. I mean, I did not know about that. I did not know about the MS. Like, I learned a lot from this today. So I would very much be interested in that research if you wouldn't mind sharing it.
Yeah, absolutely. I'd love to.
And I wanted to also make sure that we left space towards the end for you to, share with our audience a little bit about, your practice, your podcast, how they can find you, work with you, things of that nature.
Yeah, absolutely. Thank you. So my website is just drheatherheck.com. There's sign-ups for webinars, all my podcast episodes where we've talked about, psychedelics. We've got 3 episodes, well, actually 5 episodes on that. But we've covered everything, just holistic health. So from gr green cleaning to um, the discussion of life after death and the science behind that.
Mhm.
So really just fun stuff, healthy recipes. We're on Instagram at Dr. Heather Heck as well and Facebook. So lots of different ways to get in touch.
Awesome. I feel like we need to have some more conversations down the road, but
Yes,
yeah.
yes, I love that.
Yeah. But this has been fantastic. I really appreciate you coming on today, Dr. Heck. I learned a lot. I hope our audience learned a lot as well. Yeah, very fantastic. Thank you.
Yeah, thank you so much for having me.
All right. Well, until next time, everyone, take care.